Good afternoon, everyone, and welcome to the Multicultural Media Online Conference. I'm Jesusa, Helaratne, Deputy Director of the Multicultural Health Communication Service. And on behalf of New South Wales Health and Multicultural New South Wales and our service, thank you for joining us today. I am joining online as I have some flu-like symptoms, so I had got myself tested. But this afternoon, we have the Honourable Minister for Multiculturalism, Natalie Ward, and Deputy Chief Health Officer, Dr. Marianne Gale, to provide COVID-19 updates and announcements, and will answer all your questions. We would like to begin by acknowledging the traditional owners of the land and where we are all meeting from today. I'm joining from the land of the Darug people. We pay our respects to elders past and present and emerging, and extend in respect to Aboriginal elders and colleagues. We also like to acknowledge the elders from all multicultural communities and groups represented on this online briefing. We would like to request if you can please keep your microphones on mute as we hear from Minister Ward and Dr. Gale. As we have only 30 minutes for this Multicultural Media Online Conference, we'd like to thank you for submitting your questions in advance, and also for any questions you have, please put it in the chat. And we will start, and it's my pleasure now to hand it over to Minister Ward. How are you today?
Hi, Jess, I'm well, thank you so much. And aren't you a wonderful example of doing exactly the right thing, having some symptoms, recognising those and acting on it quickly. So well done, Jess, you're really a leading light. And hi, everybody, it's great to be with you all again this week. I also, of course, acknowledge the traditional custodians of the lands on which we meet and pay my respects to elders past, present and emerging. For me, that's the Gadigal people of the Eora Nation, and I thank them. Well, Jess, as we move into our next chapter, post-lockdown, who can believe we're finally here? But it's still extremely important that we continue those conversations around vaccination, around testing, exactly what you're doing, Jess. If you've got some symptoms, get tested, stay home. So yesterday, I was very excited to get out and visit two of our recent funding recipients who have been doing great work in their local communities. I spoke to so many of you via Zoom so many times and said how much I'd look forward to meeting in person. Well, yesterday we got to do that. The Sikh Mission Centre in Austral, was wonderful to go and see them. They received $20,000 from the New South Wales government, and it was wonderful to visit their temple and personally thank those who've made such an important contribution during this challenging time. I met with leaders and volunteers. We talked about the funding. That will allow the centre to continue to support the community through conversations over the phone, meeting in person and online to continue to promote testing and those local vaccination bookings. We know it's so important that they continue to produce those resources in language, and it was great that I could see some of those during my visit yesterday. So I thank them very much for generously hosting me out there, and I thank them for their ongoing work. Secondly, I visited the Assyrian National Council in Wetherill Park and met with their leadership, their staff and their volunteers. We were pleased as a New South Wales government to support the ANC with $30,000. It's a funding boost to continue to support their community engagement. And they do that at the Assyrian National Council through their online media platform, and that will engage with more than 40,000 people about COVID-19. So I'm really pleased that we had an opportunity there to see some of their translated resource and to meet with them in person and just look them in the eye and say thank you. So from the bottom of my heart and on behalf of the New South Wales Government, I'd again like to thank both the Sikh Mission Centre and Assyrian National Council for making me feel so welcome, along with so many others who've done so much work, and I look forward to coming out to meet with all of you as soon as I possibly can. Jess, today I'm delighted to reveal that more than 110 grassroots programs supporting vulnerable and multicultural communities will share in over $2.4 million in further funding. We know the great job that is being done out there, and we want to continue to support everybody to do that work. So those successful recipients have received up to $40,000 each through our Stronger Together grants program and our Empowering and Supporting Local Communities grants program, which were introduced, of course, during the pandemic. I just wanted to call out some of the recipients and highlight some of the wonderful work they're doing. The Celebration of African Australians group, which is working with members of their community struggling with mental health issues. Aquatic Tutoring Australia, which helps settled refugees and migrants in Coffs Harbour with free swimming lessons and resources and workshops. And it's so important as we have the first day of summer today and we're getting into our swimming season. Also, the Institute for Economics and Peace Limited, which is supporting African Australian communities with training in peace leadership and project development. Wonderful work with the aim of building peaceful and resilient communities across New South Wales. Jess, there are dozens more projects that have received funding. I would love to call all of them out. I'll try to do so across our future seminars, but it's just so important each of you continue to do great work in your own right as we reach out to all corners of our wonderful multicultural communities. So thank you to all of those recipients and everyone that's working so hard. I thank each and every one of them. So with that, Jess, I might hand back to you to get on with the rest of Dr. Gale's remarks.
Thank you so much, Mr. Ward, and it's good to hear all those announcements and also to call out those participants from those grants. Now I would like to request Dr. Gale, how are you? And for your updates, it's a pleasure to see you again.
Thank you very much, Jess. Lovely to be here. Lovely to see you all again. It's been a few weeks. Look, in New South Wales, in the 24 hours till 8 p.m. last night, there were 251 cases of COVID-19. And we continue to see our daily case numbers hover around that average of around 200 a day. So as a community, we've done a really great job in continuing all the efforts around increasing vaccination and getting tested and observing all those practices like hand washing and mask wearing, especially indoors, that's really having an effect around keeping our case numbers relatively low and stable around that 200 mark. We're really pleased that the vaccination rates continue to climb. They're climbing more slowly than what they did before, but that's because, so many people in our community have now been vaccinated, and that's terrific. So across New South Wales now, 94.6% of people aged 16 years and over are fully vaccinated, have received one dose, and 92.5% of people are fully vaccinated. And in our young people as well, the coverage of vaccination continues to increase, which is really great. And we really want to see that rate in our young people continue to rise. And I encourage parents out there and young people themselves to please come forward to be vaccinated. Currently, amongst our 12 to 15-year-olds, 81.3% of people have received a first dose and 76.7% of people are fully vaccinated. I guess the other big piece of news that I'm sure people have been well across from the media reports in recent days is the emergence of a new variant of concern deemed by the World Health Organization, and that is Omicron, the new variant that really has emerged from the Southern African region, at least as far as people know, but there's a lot of scientists across the world working really hard to understand the exact origins of this new variant of concern. What we do know is that it is quite prevalent across South Africa, Botswana, and a number of other countries in Southern Africa. And as people will have seen announced in recent days, that's why the Commonwealth Government has introduced some travel restrictions for 8 countries, and those 8 countries are South Africa, Lesotho, Botswana, Zimbabwe, Mozambique, Namibia, Eswatini, and Malawi. And so there's some particular restrictions on travel for people coming from those regions. And it's because at the current time, that's where we think the majority of the infections are. But again, what we're learning, and the news evolves very rapidly, and each day that picture changes, is that we know that there are increasingly cases identified in other countries around the world, obviously including in Australia, but there have been cases identified in the UK, in Germany, in Portugal, and a range of other countries in Europe. And it's possible that the virus has been circulating in some of those countries for quite a number of weeks. So there's a lot of work going on to rapidly understand this Omicron variant. In New South Wales, we have 6 cases of Omicron in returned travellers. And so we continue to be really vigilant with people arriving from overseas. And there are some changes to quarantine as well, which has been announced in recent days that I know that there are a few questions about, and we're happy to discuss that today. So I'll probably leave my comments there. Thank you, Jess.
Thank you so much, Dr. Gale. And it's good to get all the updates on the new COVID variant. And a question from Marina Belkina from Russian Talk or TV, a Russian TV channel. The cases of the new COVID-19 variant Omicron has been found already in many cases, as you mentioned, and not just in African countries. What measures did the government, New South Wales government, applying or planning to apply to prevent the further spread of the virus from international travels? Minister Ward.
Thank you, Jess, and thank you, Marina, for the question. It's an important one. We will continue in New South Wales as a government to maintain those measures and increase penalties for non-compliance as it continues to take. We want to take that precautionary approach to quarantine arrangements for our overseas arrivals in line with the additional national border security measures by the Australian government. So we want to be consistent with those. So travellers arriving in New South Wales from those countries that Dr. Gale mentioned, they have to be ensuring that if they've been in those countries during the 14 days before their arrival in New South Wales, they must enter into hotel quarantine for 14 days, irrespective of their vaccination status. We just want to make sure we're taking those precautions. All other overseas travellers, so from countries not listed in those African countries, they must complete a PCR test and isolate for 72 hours at a nominated address or accommodation. So a little bit more flexibility there with those other countries. People will only be able to exit that isolation at the end of the 72-hour period if they've received a negative result. And after exiting that isolation, they must complete an additional PCR test on day 6 after arrival and comply with the ongoing health guidelines for recent fully vaccinated arrivals. So we're just putting some really clear guidelines around those so that people understand that we're helping to protect the community. But to do so, we will increase penalties for non-compliance with isolation and testing and quarantine requirements. And those penalties will be $5,000 for individuals, that's up from $1,000, and $10,000 for corporations. And that has taken effect from today. So I just wanted to be clear, the Premier was clear about that. We are very well prepared here in New South Wales. Everyone has done a lot of hard work, but it is important that we don't lose that hard work, that we take those necessary steps to protect our community and adopt those measures that will allow us to learn to live with COVID as we are. So we're very clear about those going forward.
Thank you so much, Minister Ward. A question from Marianne Murad. Are the current vaccines effective against the new COVID-19 variant? And is the new variant, worse than Delta? Dr. Gale.
Thanks, Jess. Look, that's the million-dollar question, really, that all of us around the world are asking at this current time. But the bottom line is that we just don't know yet. But there's a lot of work ongoing to unpack exactly those issues. And we know that in our current settings in New South Wales and all the measures that we've put in place and our rules around contact tracing is all really based on our knowledge of Delta. It's based on, the national modelling that's around Delta, how transmissible is Delta, how effective are our vaccines around Delta. And we've seen that that's been true because our numbers, we know now how to manage Delta. We've brought our numbers down and we're managing. But what we don't yet know is exactly those things around this new Omicron variant. How effective is the vaccine? We don't know the answer to that yet. Scientists are working really hard to look at those issues, and it's possible that in the coming weeks, some evidence around that is going to start to emerge. There is some concern that the vaccine may not be as effective just because of the number of mutations that scientists are seeing in the new variant, but we just don't know that in reality yet. So we need to wait for some weeks to understand a number of issues around the characteristics of this Omicron variant, including how effective are our existing vaccines, how effective are the treatments that have been developed against COVID for this new variant? How easily transmitted is this new variant compared with Delta? We just don't know at the moment. And very importantly as well is how severe is infection with this Omicron variant. We know anecdotally from South Africa that they report many reports of mild illness. However, we know that the population in Southern Africa is quite a lot younger than our population in Australia. And what we need to answer some of those questions is large and robust and what we call like well-designed studies to actually look at these questions of how severe. There have been some indications in provinces of South Africa in recent weeks showing increases in hospitalizations. So we are looking at all of that data. But in essence, the next few weeks are going to give us more information about this Omicron variant in terms of how transmissible it may be. Are the vaccines effective? And if so, how effective? Are the treatments effective? And if so, how effective? And how severe might disease be?
Thank you so much, Dr. Gale. A question from Fred Zhang, Chief Journalist of Sydney Today. He'd like to ask, many international students have to change their back to Australia schedules again due to the new border control measures. How would the New South Wales government assist them? Minister Ward, a question for you.
Thank you, Jess. Hi, Fred. Great to see you here again today, and always appreciate your questions. Yes, it's a good question because we know that there's been some changes federally, but in New South Wales, we intend to continue with our pilot program flights in December. So we'll be welcoming those students back. They'll be landing those flights on the 6th of December and the 24th of December. Those flights are, of course, part of a separate travel exemption process under the New South Wales International Student Arrivals Pilot Plan, which is supported by the New South Wales and the Commonwealth governments. International students who enter in New South Wales will still need to isolate for the 72 hours according to the current public health orders. So they'll have to comply with that, of course. And in New South Wales, we'll continue to monitor the situation relating to Omicron, the new variant, and we'll make any changes necessary as they evolve. But education providers are communicating directly with those returning international students to support them, supporting those who need assistance with arranging accommodation for that 72-hour isolation period. So I thank them for doing that end to end. We want to welcome these students here and make that transition as easy as possible.
Thank you, Minister Ward. And I think Yi Wendy, who just put a question on the chat, what kind of impact will Omicron have on overseas students returning to Australia? And you just answered that, Minister Ward, and the government is supporting. I guess another question here is that what will the new variant do? Is there going to be any stay-at-home orders or possible lockdowns? And will the students and children be told to stay at home again? Dr. Gale, is there a possibility of that?
Oh, thanks, Jess. Look, I think from a health perspective, we are monitoring the situation very closely in terms of all of those factors that I mentioned earlier. At this point, we need more information about exactly what to expect from this Omicron variant. And in the coming weeks, we will know more. And at the current time, we have 6 cases in New South Wales. And we are monitoring those cases very carefully, really doing very intensive follow-up and contact tracing around 2 of those cases who've spent time in the community. And so we will be working very hard to have a very precautionary approach in this period until we learn more. And in due course, depending on the experience overseas and the evidence that comes to light, we'll be providing, that advice to government to consider about what the potential impact might be in New South Wales and what potential measures could be taken.
Thank you so much, Dr. Gale. A question from Dr. Boshra Al-Ubaidi from the Iraqi Australian University Graduates Forum. How is it possible that people who are positive from COVID Omicron have entered Australia? What about the PCR test, which is a must before departure in the countries? I guess a question about the vaccination. Minister Ward, this is a question people want to know if these rules are being implemented before they arrive.
Thank you, Jess. Well, look, those matters are for the federal government as they work with border controls to make sure that we're monitoring those situations. We will, of course, work with them. And I'm not sure if Dr. Gale has anything to add about the testing protocols, but obviously those entry requirements are closely monitored by our federal counterparts, and we speak to them to try and ensure that we can streamline that process. But if there's testing protocols around prior entry, it's something that they will be dealing with.
If I can add, Jess, yes, thank you. Look, yes, again, we work very closely with our counterparts in the Commonwealth, and those requirements for testing before arrival are things that they work on. From our perspective, once people arrive in New South Wales, it's really important that people do follow the requirements for testing, which are laid out as legal requirements for overseas travellers when they arrive. And we really need people to do that first test within the first 24 hours of arrival and the test at day 6. And an important plea to anyone in the community who has arrived from overseas since the 1st of November. And if you haven't yet got your test, just a reminder to you that you really need to do the testing as required. There is compliance checking that we are doing. And as Minister Ward outlined, there are penalties as well associated with that. So very important that if you have arrived from overseas, especially in recent weeks, or if anyone in your family circle or your friend circle has arrived from overseas, please remind them that they do need to get tested. It is a legal requirement. And very importantly as well, they need to monitor for symptoms, and if any concern around even mild symptoms, very important that they go to get tested. So important message for anyone who's arrived from overseas, especially in recent weeks. And very importantly as well, if anyone has arrived from any of those 8 Southern African countries, they are required to have 14-day period of isolation as well. So very important, if anyone has arrived from those countries, please look out for those guidance, and prospectively, people arriving from those countries will need to be in hotel quarantine. But for all travellers from any other country, as Minister Ward outlined, there is that period of 72 hours of self-isolation, and very important to get the test done.
Thank you so much, Dr. Gale. And a follow-up question, I guess this is the booster vaccine. Is it effective, and when will this be? The question is it effective against Omicron?
Oh, thanks, Jess. Again, it's one of those questions that we don't quite know yet. There is some evidence to suggest, and some experts saying that potentially boosting may have some effect in protection. And we know that some countries overseas have accelerated and broadened their programs for boosters in the recent days. So look, Omicron or not, it is very important anyway that people who are eligible for the booster dose do get it. We know that there's still plenty of Delta virus around as well, and we know for sure that the booster is very important in protecting from infection from Delta. So irrespective of Omicron, the booster dose is very important for people who are eligible, and the booster dose may have some protective effect also from Omicron, but we just don't know enough about that yet.
Thank you so much, Dr. Gale. And Minister Ward, probably a question for you. Dr. Gale did highlight what people need to do when they arrive in Australia and in Sydney, but what should we be reminding parents or overseas families before they come to Australia?
Yeah, thank you, Jess. It's a good question. We obviously need to be keeping up to date with the health orders here, making sure that we're getting those vaccinations that, of course, are compliant with our Australian standards here, making sure that we're communicating effectively about what those requirements are and the wait periods, because we know that you can't just get off the plane and come in here. You've got the isolation periods, and we really need to be clear about those going forward. We want to provide certainty to people coming home and to families, welcoming family members home. we will continue to maintain those measures. We'll keep in place those rules for as long as it takes to continue to take that precautionary approach to those quarantine arrangements for overseas arrivals, in line with the federal government's national border security measures. So, the federal government obviously makes those arrangements, but we will continue to support those here in New South Wales so that we can have all travellers arriving here, as we said, from those particular African countries for the 14-day period, but making sure that they are in that hotel quarantine irrespective of the vaccination status. But I would say to everybody, make sure that the vaccinations you are getting are ones that are compliant with Australian standards. Of course, there's different ones around the world. I'm no health expert, but I do know that we're very clear here about what we expect. Of course, the PCR testing is really important. It's simple, it's easy to do, and we expect that our overseas travellers complete that. Of course, our airlines are fantastic in ensuring people carry that out before they get on the planes, and that as soon as they get here, they must complete that PCR testing and do that isolating for 72 hours at their nominated address or the accommodation that they nominate. So we know that after they've done that 72 hours, if they've received that negative result, they've done that PCR test, they've done all the right things, and they'll be able to exit isolation at that point. So we really feel that that's come a long way from our original 14 days. We know that if you do the proper steps beforehand, you'll be out of that isolation in the 72 hours. Of course, you must complete that additional PCR test on day 6 after arrival. So making those steps clear to everybody before they leave, that you have to take those steps prior to getting onto the plane, once you get here during the 72 hours, and then additionally on day 6 after arrival, so that you're complying with all of those health guidelines and that we can continue to emerge out of COVID and enjoy our beautiful Australian summer here, and we can all get outside and enjoy each other's company and reunite those families and friends over this summer period. But compliance again, Jess, as you say, and as you're demonstrating yourself today, the slightest of symptoms, go and get tested and isolate. And let's not get slack about that. We've done such hard work to date. Now it's really important that we protect the community, protect each other, because we've done that great work. So I can just encourage everyone to do exactly what you're doing, Jess, and just keep an eye out for yourself and for each other.
Thank you so much, Minister Ward. Dr. Gale, how important is it, especially during this time, to get vaccinated?
Thanks, Jess. Look, it remains very important. As I said earlier, the Delta variant is still with us. And we know that while our case numbers in New South Wales have gone down, there's still Delta that we're identifying every day, and still lots of work being done by our contact tracers to contain the spread of Delta in Sydney and in the rest of New South Wales. We know that our neighbours in Victoria continue to see quite high case numbers, so we continue to live with Delta, particularly in New South Wales and Victoria. So getting vaccinated is still extremely important. Getting your booster doses when you are eligible is extremely important. And the evidence will emerge about what we need to do in response to Omicron when it comes, and in terms of how well our vaccines will work. But, scientists and the experts around the world are working really hard on these issues. And as soon as we know more and we have more evidence to guide us, then all of that advice will come to light and will be shared with our community.
Thank you so much, Dr. Gale. And we've run out of time. Before we go, just some last words from Minister Ward.
Thanks, Jess. Just again, I want to thank everybody for coming together. It's been so important during this journey, but also important now as we continue on emerging from COVID, dealing with this new opportunity, this new chapter. There will be various chapters in our journey through the COVID-19 pandemic, but again, so importantly, our multicultural media is right there conveying those messages as we go through each of these different stages. And I just want to thank all of you once again for the wonderful work you're doing. I very much look forward to continuing our discussions, and welcome your questions, and thank you for your interest in the great work you're doing out in the community.
Thank you so much, Minister Ward, and for all your hard work. Dr. Gale, any last words?
Oh, thanks, Jess. Look, no, just a big thank you to the community for all the work that you're continuing to do to get vaccinated, to get tested, and to practice those COVID-safe measures. They are absolutely important. They will continue to be important, even with Omicron into the future. So very important to continue those important practices. And look, I think we're just going to have to wait and see what Omicron brings us. But all of those things that we've learned and those changes that we've made along the way remain very important: to get tested as soon as you have symptoms, to come forward and get vaccinated, and to be COVID safe around your friends and your family.
Thank you so much, Dr. Gale, and thank you very much, Minister Ward, for being with us today and answering the questions. And to all of you Multicultural Media Online, thank you for always joining us. We at New South Wales Health, Multicultural New South Wales, and the New South Wales Multicultural Health Communication Service truly appreciate your support in disseminating the key health messages to multicultural communities across New South Wales. The recordings of this briefing is available on the New South Wales Multicultural Health Service website. And for those celebrating Hanukkah, the Jewish Festival of Lights, hope you have a happy and COVID safe celebration. Have a good afternoon to you all. Be kind to one another, and we'll see you again next week. Thank you.